Breast cysts are fluid-filled sacs that are usually non-cancerous. Sometimes, you can feel them, especially if they become painful a few days before your menstrual cycle. In most cases, breast cysts don't need treatment. What is a breast cyst? A breast cyst is a non-cancerous or benign, fluid-filled sac in your breast. It occurs when fluid fills an empty milk duct. Some cysts are too small to feel, while others grow up to several inches, large enough for you to feel and even make you uncomfortable. Clusters of cysts can form in one breast or both. Breast cysts don't increase your risk of developing breast cancer. They also don't turn into anything more serious. You're more likely to get breast cysts if you're between 35 and 50 years old. Premenopausal, which means you still have a menstrual cycle. Postmenopausal is you no longer have a menstrual cycle but take hormone therapy, HRT. There are 3 types of breast cysts. Simple breast cyst, filled entirely with fluid. Simple cysts are always non-cancerous. There's no solid area in the cyst, and the cyst wall is smooth. They make up about 90% of all breast cysts. Complex breast cyst. This type of cyst, which has a mix of fluid and solid components, may be breast cancer in up to 20% of cases. Your provider typically biopsies the tissue, which means they remove part of your breast tissue and send it to a lab for analysis. Complicated breast cyst. A complicated cyst is fluid-filled, but may have some cloudiness to the fluid, or the borders may be somewhat irregular. Sometimes, these are aspirated with a needle biopsy, and then the tissue is sent for analysis. Other times, a provider may recommend a follow-up appointment in 6 months because there's just a small chance, less than 2%, of it being cancerous. Breast cysts are common. About 7% of all women and people assigned female at birth will get a breast cyst at one point in their lives. What are the symptoms of a breast cyst? Some cysts are so small you can't feel them. If you have a larger breast cyst, you may feel a lump that's soft or firm, although most are soft. Round and smooth with distinct edges. Painful or tender, especially before your menstrual cycle. Larger just before your period starts and smaller after your period. Easily movable under your skin, especially large cysts. Breast cysts can be tiny, like a grain of rice or a pea. They can also be as large as a golf ball. Many people notice their cyst changes or become sore just before their period when hormone levels change. Others have nipple discharge or localized pain. The exact cause of breast cysts is still unknown. Experts believe natural hormonal fluctuations may cause them to form. Breast cysts don't usually develop after menopause when estrogen levels taper off. It's also thought to be a part of the normal life cycle of a breast, when the milk-producing glandular tissue shrinks, involution, and fluid becomes trapped. Healthcare providers often find breast cysts during routine mammograms that screen for breast cancer. But you may also discover a larger breast cyst on your own. How is a breast cyst aspiration performed? During needle biopsy, also called an aspiration, a healthcare provider inserts a hollow needle into the cyst. The cyst will collapse as the fluid is withdrawn. How are breast cysts treated? In most cases, you don't need treatment. Simple breast cysts don't cause any harm and sometimes even go away on their own. If the cyst is uncomfortable, your healthcare provider can drain the fluid from it with a needle. However, the fluid could come back. If it returns and continues to be painful, you may need surgery to remove it. Often, breast cysts go away on their own. It's important to contact a healthcare provider if you notice any changes in your breasts so they can examine you. Performing breast self-exams and attending annual well visits or mammograms go a long way in noticing these changes. How do I prevent breast cysts? You can't prevent breast cysts, but regular self-exams and routine mammograms are good ways to manage overall breast health. Never assume a new lump is just a cyst. It's always better to contact a healthcare provider for an exam. Do breast cysts increase your risk of breast cancer? Breast cysts don't increase your breast cancer risk. Can a breast cyst turn into a tumor? A benign breast cyst doesn't change to a tumor. This is a common misconception. Are breast cysts serious? Breast cysts are very common in women and people assigned female at birth and usually aren't a sign of a problem. When should I worry about a breast cyst? Most breast cysts are harmless and shouldn't be a cause for worry. But it's a good idea to have your healthcare provider check out any breast cysts to be sure. What questions should I ask my healthcare provider about breast cysts? If you've been diagnosed with a breast cyst, consider asking your provider. What type of breast cyst is it? Does it need to be aspirated, biopsied, or removed? Do I need more frequent mammograms or ultrasounds? Should I continue on hormone replacement therapy? A note from Cleveland Clinic that breast cysts are common, especially among people in their 40s. The good news is that these cysts are almost always harmless. Though cysts are common, always have your healthcare provider check out any new lumps or bumps you find. It's always best to be cautious when it comes to your health.